Okay, now we're going to, who is that? North Carolina. Hello, is that?
Hi.
Hi, how are you?
I'm good. How are you? My name's Nikki.
Oh, yes, there we go. Okay. Just having trouble with the screen. Thank you.
I have a Chihuahua. She's about 9 years old. She's had a heart murmur most of her life, and a couple of months ago I had an echocardiogram done, and her vet said her heart is somewhat enlarged, and he put her on something to lower her blood pressure. And I really had a question in regards to food. He said she needs to be on a low-sodium diet, but I don't really know how you determine if a pet food or pet treat is low sodium. They don't really give much in the way of indicators as how much sodium is in it. I was wondering if you had some advice on how to look for that sort of thing.
Well, I think, did he just put you on one medicine?
Yes, it was to lower her blood pressure.
Okay. As far as that goes, I think that in that case, you probably would be fine if you pick out most, as far as the national brands, if you just go with like a senior diet, most of those are going to be a little lower in sodium.
Okay.
As things get worse, if we want more sodium restriction and significant sodium restriction, then you go to things like there are some prescription diets, like Hills makes one called KD that stands for Kidney Diet, that's sodium restricted, and also they think they still have their HD too, which stands for Heart Diet. But the big thing that I worry about with that is kind of the same as far as people that have heart disease or congestive heart failure, and that is that you can follow that low sodium diet all along. But where we really have the problem is, and where we really could have a problem is if, a sudden sodium load, as far as like right here around the holiday season when people eat too much ham or salty foods at family get-togethers and things like that. And so really where our problem comes in is more like if they're used to getting like a bite of ham, lunch meat, or things like that, things that are real salty foods, or in our treats are going to be a big thing too. Treats. And so a lot of our dog treats, just like our junk food, is loaded with fat, loaded with sodium, not really good for them. And so that's where I'd really concentrate too, is looking for healthier treats as far as that goes, instead of your standard especially those that are kind of chewy and greasy to the touch and things like that. Those are probably not going to be good things to do.
Right.
Yeah, the only thing she gets treat-wise is Dentist Sticks and Eukanuba Senior Treat now.
Yeah,
I've pretty much removed everything else from.
Yeah, and as far as, and I don't have
table, so to speak.
The exacts in front of me, but I would imagine that those would be perfectly fine, and especially if she's able to be managed with just one medicine right now, I think that you'd probably be perfectly fine with those.
Yeah.
Yeah, the only time our dogs get treats would be Christmas or Thanksgiving. We give them what's called a Tasty Bowl, which is usually rice and a little giblet gravy. Is that okay, or do you think that might skip that?
Yeah, I'd skip the giblet gravy part.
Yeah.
The rice, if you don't add salt to it, the rice is fine.
Right.
But there's things you can do with that too. Is you could get you could do the rice, and instead of the gravy that probably is kind of high sodium, you could do like some white meat turkey that that you haven't added salt to, or like a low sodium canned white meat chicken, something like that, and chop it up kind of fine and put in there, if you wanted to do something like that, because then we've got a low fat, easily digestible, bland meal that certainly would be a treat.
Yep.
So.
Okay.
Yeah.
All right. Thank you.
Okay.
Yeah. Okay.
Bye.
Thanks, Mickey.
Thanks.
Bye-bye. So, a lot of soups and gravies are loaded with salt.
Yes, they are. I mean, and that's a big thing for people too, that, sometimes people forget to read labels.
Right.
And in dog foods, we've got the standard label on there, and it doesn't really, help a whole lot because it doesn't say sodium content, on there. But most of the time, our national brand senior foods are, they're tailored for animals who, whose kidney function or other things may be slowing down, and so they may be, lower in sodium, a little lower in protein, less calories, and so most of the time early on in disease, that those are going to be okay.
Right. Okay.